Michaela, say some magic words.
Present.
Yeah. Outstanding. Outstanding. All right. One reminder for folks in the room, we're not using the speakers up top. We're using these. So when you talk, you got to turn on your little deal. All right.
Got a control.
Kurt.
Present.
Outstanding. We hear you loud and clear. Harry.
Present.
Outstanding. And Michael Tunick, AGO.
Present.
Excellent. And I'm sure. Oh, is Sharon with us now?
I am present. Thank you.
Oh, that's right. We saw you last time. We did not hear you, but you are present. Excellent. And I'm Lou McDermott. I'm filling in for Marianne today. With board members attending both in person and virtually, it'd be helpful for board members to hold their question until each presentation is done or when the presenter pauses and asks for questions. Board members attending virtually, we're going to be watching for your Zoom hand in case you have a question. And there's a couple of, or do we have a couple of resolutions today? We're not going to do the meeting minutes. We discovered some issues with that, but we do have a resolution for today. And the public's going to have an opportunity to provide comment on those resolutions during normal procedure before the board votes. The public's also going to have an opportunity to provide comment during the public comment period near the end of the meeting. I think we're going to exec session and they're going to get an opportunity before. Okay. And as a reminder, if the public has questions during staff presentations, the presenter's contact information is going to be included at the end of the presentation, and the public's welcome to email presenters during the meeting to capture your question for response after the meeting. Dave's going to, oh yeah, I did the piece about the machine and talking. Dave's going to give us an overview of today's agenda.
Good morning, Chair McDermott, members of the board. Glad we are all present and accounted for and hearing each other. I feel pretty good that we'll catch up on time regardless. So don't worry about that. I think we'll be fine for time purposes. We're going to not do the approval of the minutes because we noticed that we mixed up the chairs in the document. So we'll bring you the April minutes next month when we also bring you these minutes. So we'll just get right started with a follow-up on a couple of questions that I have that didn't quite fit neatly within another presentation that came up last meeting. Then the legislature has adjourned. The governor is still acting on bills through next week, but Cade will review what bills are passed, which are signed and which are still pending signature. And then Tanya will go over what the final budget that passed the legislature looked like that the governor is still reviewing and can act on through next Tuesday. Then Stella will join us, and we have the first of two resolutions for you to act on today. That one's related to eligibility enrollment. Then we will do an update and prepare you for hopeful action next meeting on changing the long-term disability benefit to align with the authority that was added in the budget that Tanya will go over, so that we can have you adjust that benefit for 2026. Then we will do something that's a little unusual. We don't do it that often, but we have a resolution related to the Uniform Medical Plan design that we're introducing and asking you to act on today. And when we get to that presentation, I'll talk a little bit more about the full context of why we're asking you to take action at the same time rather than delay and wait another month. But Ryan will join us for that. We'll have an update from Jean about benefits 24/7, and then we will go into executive session after public comment. A couple of just general house cleaning things. Reminder, if you need the bathroom, walk down the hall, see elevators, look to your left. If we have an emergency, we walk purposefully across the street into the visitor parking lot. I'm just going to go ahead and jump right into my follow-up since we're skipping over the minutes, and you're going to be behind tab number 4 in your materials for this. Just a couple, there's just one question that I wanted to go over here. The question is essentially a specific question about something that is or isn't happening at the federal government. There's a lot of things and lots of news coming out of the federal government right now related to a variety of topics because of the action that's going on with the federal budget proposal. But this question was specific to, has the current federal administration made any changes to the Medicare drug price negotiation program? And my caveat here is I'm answering this question as of last Friday. It's a little bit hard to kind of keep track of all the moving parts in the last, in any given 24, 48 hour period, but this is at least as of last Friday. So just that little asterisk. So going back going to the next slide, There was an executive order that was signed about a month ago, on April 15th, that addressed aspects of the Inflation Reduction Act. And that is the federal piece of legislation which did set up and included the price negotiation process from CMS on behalf of Medicare. So there is a period of time in which HHS is looking at, I won't read this verbatim, but is looking at that negotiation process for future years. And so there could be modifications to that process in the future, but this executive order was kind of setting up that process. If we go to the next slide, the summary is that it does not appear that there are specific proposals yet that would change things in the near future. And going back to the prior slide, you don't need to move there for purposes of navigating the slides. It does appear that ultimately there would need to be congressional action because this was of how the Inflation Reduction Act was legally written. So the pharmacy team's going to keep monitoring things. So I think the big takeaway is, yes, there's talk about potential changes. It appears that some congressional action would be needed, and there's no specific change that is in the works at this moment. Again, as of last Friday. Any questions about that? I do have one more topic to talk about. All right. You can just leave it on the question slide for this. There was another update that I wanted to provide that stems from public comment that was received last board meeting. At the end of the board meeting, there was a member of the public that came who is a substitute in SEB, and their spouse works at the University of Washington in PEB, and they were raising questions about the relationship of the spousal surcharge, which is the $50 monthly surcharge designed to disincentivize someone from waiving other employer coverage, medical coverage that is comparable to, and the whole design of those surcharges is to avoid shifting costs from one employer to another. So that question that was raised last month, we realized that there are several things that have changed between the PEB and SEB programs in the last couple of years. In particular, that prohibition on dual enrollment that went into effect about 2 years ago. And there was, you'll probably remember, a complex set of about a dozen policies that were brought to each board. So about 24 resolutions related to that, talking about various eligibility situations and automatic enrollments and waivers between the programs. And so this, just looking at all of this from this fresh lens of this question, has led us to begin implementing an adjustment to the surcharge policy when it comes to spousal surcharges. And we're going to clarify, because as we looked through both the questions, the way they were asked to individuals, how they were responding to them, the exact way that the rules were written, there's an opportunity to be clearer. And so we're going to implement it this way, that a spousal surcharge will not apply in those instances where a spouse is waiving SEB eligibility to remain as a dependent in PEB, or the opposite. So when they're waiving PEB eligibility to remain as a dependent in SEB. So we are working on the necessary rules and administrative policy revisions and adjusting language on the surcharge form, as well as the language that's in benefits 24/7. And because these surcharges are paid on a pre-tax payroll deduction, we actually have a little bit more flexibility. So the way we're implementing this, we're going to implement it retro to January 1st of this year. So that means we're actually going to be issuing some refunds to some accounts that have been paying that surcharge in this situation where they kind of have that dual eligibility scenario and they're waiving to go to the other program. So we have pulled that data. We've been working on the billing files to be able to issue those refunds as part of our standard billing files this month. Begun some communications with benefits administrators at state agencies and school districts about this. And we'll also be sending a direct mailer to the individuals who are receiving a refund to help them explain that. So we're actually going into the system, making the adjustment on the account to indicate that they won't be paying the surcharge prospectively, and then again, making that retro to January 1st. So this is a great example. There are a lot of times where it takes, our systems are really complex and sometimes we can't move as fast as we want. But in this instance, we were able to identify a way to be able to account for this scenario. Really happy and glad that a member brought this forward to both boards, either in correspondence or in public comment. And it just gave us a fresh look at how these were implemented and the underlying design for them and the purpose of them, and to go, these programs are similar enough. Essentially, think about it that both of these programs are fundamentally primarily funded by state dollars. And so shifting costs from one program to the other, it's the same fundamental payment from a funding rate that's supported by the state. And so that disincentive for cost shifting between the employer really isn't there when you're crossing programs, and we're just clarifying that going forward. So I did want to provide that update because it was a public comment that was brought. We got right on it. We've been communicating back with that particular member, but we're also doing it systemically for both programs. And Tom, you have a question?
Yeah, actually, it's about the drug pricing.
Sure.
My understanding was that those new negotiated prices, the first list of 10 drugs, is that supposed to go into effect January 2026 or was it January 2025?
I believe, I think we're going to cover a little bit of that in executive session, but I believe it's January 2026. The effect of the Medicare Part D negotiations. Yeah, it's 26. The negotiations were last year, but they go into effect in 2026.
So my question is that going to be impacted by, because one of the things I did read between the April 15th memorandum and just within the last few days is that they were talking about renegotiating some of the prices for different drugs. There was no list prepared, just that they were thinking of renegotiating. And so if you're looking at maybe the impact of those lower drug prices affecting what members have to pay for dues, is that going to be impacted by this decision to maybe now we're going to re-examine the prices for drugs?
And is this something we're covering in a presentation today?
It's not covered in presentation. There's a little bit of it in executive session as we talk about what goes into rates and where rates are currently at in the rate setting process.
For executive
Oh, yeah,
session?
yeah, absolutely.
Okay.
But I think at a very high level, Tom, every day is a new day between the state and federal government right now. And we can only rely on what is set and currently used when setting rates. This is kind of part of the inherent tension in the rate setting processes. We're working on rates now to have you as a board authorize them in July, and then those are premiums that go into effect in January, and there's 6 whole months between when you set the rates and the premiums and when the plan begins, and very little necessary opportunity to make adjustments there because we have to have everything ready for open enrollment. So that's the inherent risk. We have to take the set of facts that are in play at the time we're setting the rates while trying to account for some variability as best we can.
Putting that down every day is a new day.
Yep.
Every day is a new day. Any other questions for Dave? All right. Tanya Cade, why don't you come on down? Cade Walker, Policy Rules and Compliance Section Manager in the ERB Division, and Tanya Dool, the ERB Finance Manager, are going to present the end of legislative season and the final conference budget. Materials behind tab number 5. Cade, Tanya, welcome.
Thank you, Chair. All right, we signed and died the session last month, so and no additional things in the horizon so far, pending the budget being signed. But so we'll go through. I feel like that's a lyric to something. I don't know if Stained or. All right, next slide, please. So staff did a great job this year. You can see here we had a total of 213 bill assignments and bill analyses that we conducted. That equates to thousands of hours worth of work by our team of analysts within our ERB division. I mean, the agency had probably thousands of them as well, but our division itself had the 213 with the 92 fiscal notes that Tanya's team does and our team supports in getting those analyses out. So just want to use this slide to give a shout out to all those in the division and our support divisions that worked tirelessly to make sure that we were on time with all of our bill analyses, tracking all of the information that was coming out of the legislature and the changes, making sure that we were tracking, being aware of what was happening, and making sure our agency leadership was aware of what was going on so we could stay on top of everything this session with as many twists and turns that the session did have. So thank you to all the staff and everyone who supported to make that a smooth session for us on the getting our ducks in a row, making sure we did a good job there. Next slide, please. Little less these days to track this, but you can see here we had quite the slate of bills that we were tracking that didn't make it through the process, but we did see a good number that made it all the way through, and that we were tracking that were the high priority bills for our division. Although there's certainly a lot more bills that we were tracking closely as well, just because of the tangential impacts it would have to the program. Just as a reminder, because this was a long session, next year will be the short session that concludes the legislative session that we're currently in. And so all the bills that did not make it through to the governor's desk this year will be introduced by rule in next session. So we will see that legislation again. We'll see what continues to move forward next year. And then after the conclusion of next session, then all the bills are wiped clean, and we start fresh the year after with another long session. Next slide, please. So our agency request legislation that we've talked about before, both of these pieces of legislation did pass through and are at the governor's desk. The affordability bill, Senate Bill 5083, was passed. It did go through some amending process, but it did end up ultimately passing. And so we're now in the phase right now where we're beginning implementation of 5083. It's requiring some pretty substantial rule writing for us, given that there is some new requirements on the ERB division for tracking and auditing and monitoring the interactions between our carriers and the providers when they're negotiating. So we're going to be tracking that and implementing some rules on that, and we're just starting that. Actually, I think our kickoff is tomorrow to begin that substantial rule writing process. So if there are any entities that are wanting to be a part of our rulemaking, we will be sending out the CR 101 here shortly, which is part of the rulemaking process. And then if there's any entities that want to make sure that they're included in that, please reach out to myself or anyone really within ERB, and we'll make sure that you're included in the 101, although we are putting a list together ourselves. On Senate Bill 5478, that grants this board the authority to offer a slate of new benefits. So this did pass. It went through flying colors. It extends the same benefit offering authority that exists for the PEB board in being able to offer optional benefits to employees, things that include like travel insurance, pet insurance, expanded property and casualty insurance, fixed payment. There's about 10 different types of benefits that are included in there that can be offered on an employee paid basis, subject to available funding. Now, again, it doesn't require you to do any of that, but now that both boards have an aligned set of authorities to offer benefits in the future, if there's interest, now the board has the ability to direct us to go and study some of these different benefit types that could be offered to employees in the future. Again, subject to funding, not that there would be much funding necessary from the employer standpoint for payment for the benefit, but there's still some cost that would be associated with the contract manager and the procurement effort that would go into it. But we would be able to move forward if the board so choose in the future. Next slide, please. Going down the list of things that we did see pass, House Bill 1114, including Washington and the Regional Respiratory Care Compact, where we will have the ability to have the respiratory care licensures from our state recognized in the states that participate in this compact and vice versa. So it helps to expand the accessibility of respiratory therapists, especially in our border areas of the state. House Bill 1186, this extends the amounts and the types of medication that hospitals and certain healthcare entities can prescribe to individuals. House Bill 1432, improving some of the processes by which mental health and substance use disorder services are provided, helping to provide a little bit more ease in which the services are to be delivered, and removing some of the administrative burden for individuals. House Bill 1669, while the PEB and SEB programs are not participating in it this year or not subject to it this year, we probably will see that in the future when there's probably a little bit of a budget ease for us. But it does extend for other commercial plans in the state, expanded coverage for prosthetic limbs and orthotic braces, requiring adjustments and other fittings and new equipment on a more frequent basis than is currently required by statute. And last on this list, House Bill 1971 increases access to hormone therapy, which does include hormone replacement therapy as well as other types of hormone therapies, allowing for there to be up to a year prescription allowed on the initial prescription of the hormone therapy for individuals. Next slide, please. Senate Bill 5351. In fact, this goes very similar in conjunction with Senate Bill 5579. if you recall, a few years ago, there was legislation passed that created requirements on carriers and providers to provide notices to members or to patients when they are nearing 30 days of a contract being terminated between providers and networks. I think we've all heard from different members about the confusion and concerns that this created when there's a medical plan negotiating with a large provider system and the impacts it would have to members. Well, 5579 was passed this year that places some additional requirements on those providers and the carriers to go through legal requirements and certain due diligences before they're permitted to send out those notices. 5351 extends the same sort of requirements on dental plans, so that if there are dental contracts being negotiated between providers and dental carriers, that those notices that are required by statute for medical carriers are now required of dental carriers. And we're hopefully that 5579 provisions are also extended to the negotiations and the processes that are put forward for providing notices to individuals for the dental carriers as well. Senate Bill 5498, contraceptive coverage, it extends the
Okay,
initial.
we have a
Yes.
question.
Oh, please go ahead.
So I'm just curious, what happens if you have passed these into law? What happens if they violate it? Was there any discussion about that? What happens if a carrier decides that they're going to send out something that is perceived as the kind of threatening things that have happened in the past?
I'll have to double check, but my recollection is that the OIC does have some teeth in it, as it were, to be able to enforce some of the provisions in there. It's good faith is a legal turn of phrase that is a little tricky to define necessarily. It's one of those I know it when I see it sort of things, but there is a requirement for good faith negotiations, and I believe that there would be some sort of applicable penalty or something that the OIC could require, because these statutes that have been amended are in OIC statutes. But I will gladly follow up and just confirm that with you, Tom. 5498 extends the initial amount of a prescription that can be offered for contraceptive to a full year, as opposed to only offering a year's worth of coverage on the first refill. 5525, this is a notice requirement for large employers to provide their employees in the event that there may be a large layoff. And I only mention this not because the state itself is not subject to this, even though it is a massive employer, but school districts are. So in the event that there's a school district closure or school closures, there are certain now notice requirements that have to be given to the employees in the event that there's a potential closure by the school or school district. And last here, Senate Bill 5807. This is the legislation that was passed that will effectively close the Smart Health program and the Smart Health incentive, and ends the Smart Health incentive effective 2028. So that means that all the employees who are eligible to earn that incentive and do so in the 2027 plan year will receive the incentive in 2028, but then the Smart Health platform and the incentive will no longer be available for 2028 and moving forward. There was legislation that did include the closing of Smart Health, as well as some other aspects about bargaining that was introduced, but this bill is different from that. It shaved off those other components and instead just focused on the closure of the Smart Health program and ending of the Smart Health incentive. So with that, the rest of the appendix are the pieces of legislation that I had spoken to earlier in the year that did not pass. So those are there. We'll continue to keep an eye on those for next session, as I mentioned earlier. But otherwise, that concludes the pieces of legislation that passed. So we're now working into our implementation phase. We only have a couple of pieces of legislation that require any implementation work on us. 5083, as we mentioned, the affordability bill that was our agency request legislation, and just a couple of other pieces of legislation that we're tracking, and we'll do some amending of our rules and WACs, our policies and rules in the near future. So I'll happily answer any questions that you might have. Yes.
Kate, given the possibility the governor could send the budget back to the legislature, are there any issues we should be concerned with that are in that budget that could impact next fiscal year?
I think it's a great question, and I'm going to pass that over to not me.
John, I'm planning on touching on that, but we'll just do it now. So in the In the final conference budget, yes, it has not been signed. I think it's important to note the way the PEB and SEB programs are funded is via a funding rate. We talk about the funding rate a lot, which there's no magic number. It's just one number. Within that one number, our entire budget, every bill that's passed, the collective bargaining agreement, all of our benefits, our decision packages are rolled up to that one single number. So there's really not an ability for the governor to veto or unbalance that funding rate with kind of not breaking down the entire system. So it's really unlikely that something would change our funding at this point in time. They'd pretty much have to go back to the drawing board if they were to veto any of our additional or our individual line items.
Were any of the budgets that were considered by the legislature, did they include cutting that number?
Oh, yeah.
Overall.
There were various iterations of that number between the governor's budget, the House and the Senate, and they all had different approaches to how to handle that funding rate. We didn't have significant concerns with any of those versions, actually. While one of the versions, the Senate proposed budget did have a different balancing effect where they artificially reduced kind of that first year to include it in the second year. That's totally fine and within their ability to do, and they do that. It's really on the legislature to take the risk for that funding rate. And if it's wrong, they have to, fund it back in the next year. So that happens outside of a budget deficit year also. And we didn't have any significant concerns with any of the versions we saw.
Tanya, the one thing I will just reinforce is that, like you said, that's typical operating procedure for the funding rates, even outside of a budget deficit conversation. So there was nothing really unusual about the process, even in the context of the budget deficit conversations. Because as Tanya and I like to say, there is no magic number. It's about what the underlying modeling is, and that's why it's not impossible for things to be adjusted within the state budget via a gubernatorial veto, but there are very kind of limited circumstances based on veto powers and exactly how the budget is structured and where our components for these programs are in the budget bill. So it's very unlikely, though not impossible, to make impacts.
Okay. Well, that's it. Do you have a question?
Yes, I don't know who this question would go to. I'm looking at one of the bills in the appendix 5086 that the folks who crafted that bill plan to bring it back. And they're bringing it back. I heard from the people who are working on it. They plan to bring it back and show focus on the conglomeration of funding, that by combining PEB and SEB, you will have more purchasing power. I'm not reacting to that. But I guess are you aware of that? And will that new version of the bill at least be presented to us ahead of time? Because it was part of the PEB-SEB merger packet. Thank you. I hope I'm making sense. It's kind of hard for me to grapple with the purchasing power argument, so I'm open to correction.
So a couple of different pieces. There are 5086 and 1330, which were the bills that were put forward to consolidate the PEB and SEB programs. Just right, it wasn't agency request legislation, though this agency did provide a lot of technical support. You can look at the legislative report that this agency was tasked with, and an appendix to that is a bill that is not identical to what was introduced by the legislators who chose to put something forward, but it heavily draws upon the structure and format. Though there were, I like to say there were some Mad Lib aspects to it, choose your own adventure on certain sections, kind of. So it wasn't a complete bill, if you will, from the agency. So there are a variety of stakeholders who are interested in that concept that are outside of the walls of this agency. And I wouldn't be surprised if there was continued interest in this topic. The K-12 consolidation was a debate for 30 years. I figure that hopefully, there'll be a long there'll be many conversations about whether this should be two programs or one programs over the time. If there are other iterations of the bill, we will absolutely bring them once there is information about them. I would expect if there is something like that, bills get pre-filed, but pre-filing of bills for next session isn't until like December, November. So there's, anything at this point is really kind of speculative, but if there is another iteration or that bill, that bill is still alive from a biennial perspective, as Cade said, all of the bills kind of retain a status and get introduced at a certain stage depending on where they were at the end of the first session. So that bill could be picked up, another one could be introduced. That's just kind of the normal legislative process. But if there is another version or 5086 and 1330 creates or has movement next session, we'll absolutely keep both boards advised about it.
And while we didn't have any new reports requested of our division this year, we have addressed we had the consolidation report from last year. And 3 years ago, we did have a report on some of the financial aspects of consolidation as well. So it's something that we have reported on before, but we have not been asked to do any new reports, which is great. We didn't get any reports this year, which is really nice. So we'll just continue to keep our eyes open and hopefully people let us know so we can help provide technical expertise and be aware of what's going on.
Well, if these folks are bringing it back, so I do hope I can get, I guess it's personal for me or something, but I would love to get HCA's take on it.
Yeah, well, like I said, Elliot, we'll absolutely, because we'll bring information about it to the boards, because one of the inherent parts of that entire conversation is the structure of a singular board. So that is obviously of intense interest to the people who serve on both boards. Yeah.
All right, I think that's it for me. This will be the last time you see me this year, so I will be back next year with another round of legislative updates. So thank you, everyone.
Thank you, Kate. Appreciate it.
Thank you.
All right. Thanks, Chair, members of the board. I think we've already teed up a little bit of the budget, but we'll get back into it. So I'm here to talk about the final conference budget. A lot of this should be smooth sailing since our conference budget largely aligned with the House and the Senate proposals I briefed you on at the last meeting. Next slide is just a reminder of the timeline. For the most part, what we're going to talk about goes into effect July 1st. So most of the spending that we'll talk about is starting with the new biennium this July 1st, with the exception of the next slides. So first, we're going to do a little pit stop in the supplemental budget. So during a long session, the legislature has to address both the supplemental budget, which finalizes any additional spending needs through the end of this current fiscal year, which ends at June 30th. So these are kind of emergency, one-time, true-up type items, not large policy decisions. So these are for dollars that will end June 30th. The first one is our third-party administrator, our TPA spending authority. This is just the authority to spend the money out of the account that already lives in that account. We needed some additional dollars to get us through the calendar year 2025 implementation related to Part D largely. And so those dollars are just for us to balance the books in this current fiscal year in a positive manner. The next line item is contract increases, and this is related to our actuarial contracts for our PEB and SEB programs. We have not had an increase in the PEB program in at least 10 years in the budget we spend for actuarial services. And as you can imagine, things have gotten more complex, and there's a bigger workload that's going over there currently. So we had to increase that budget just a little bit. Next, we're going to transition to the biennial versions of our decision packages, with the first two items being the same, but biennialized out for 24 months worth of spending. So we needed to increase our third-party administrator budgets to align with the enrollment in our self-insured products, both our medical and dental. And on the medical side, it's both for the medical portion Regents and for the pharmacy side MODA. And with the transition to Part D for our Medicare product, we had to align the administrative expenses with that Part D administration. The next one is just the biennialized. Yeah, Tom?
So our third party administrators, Regents is the medical.
Yep.
And then MODA is pharmacy.
Pharmacy.
Array RX.
Array RX is the brand name for the consortium So the consortium, I don't know if someone else wants to take this more, but
Sure. Um, so, uh,
uh-huh.
it's always hard to think about how to describe this. So, the Uniform Medical Plan pools its purchasing with other programs in other states, primarily Oregon, Nevada, and Connecticut at this point. You may remember back in the day, we talked about this entity called the Northwest Prescription Drug Program that is rebranded as ArrayRx a few years ago. We all pool our purchasing together. They create a master contract and go out for procurement with an entity, and that entity that they currently contract with is MODA. So MODA has the contract that ArrayRx awards that we buy into along with other states. Does that help?
Yeah, so Array RX would be, if you were to draw a line, you would draw it from uniform to Array RX to MODA. And you're talking about
It's
prescription
more of a
drugs.
triangle situation where there's a master contract that ArrayRx has that is the starting point for individual participating agreements for the various entities in the multi-states. And so there are actual individual agreements, and contract management is kind of shared and collaborated between ArrayRx and our Uniform Medical Plan staff, or the other states with their equivalents of Jenny Switzer, for lack of a better example, because I know you've met her many times, the board's met her. The other thing that's a little more complex about all of this is ArrayRx is administratively run by this agency itself. So we have the administrative staff for ArrayRx under state law. And so I always say it's kind of like the hair club for men. We're both president and client. It's this interesting relationship that we have where it's our own staff that are not people that typically are presenting here, but there are parts of our pharmacy team that work on behalf of ArrayRx with MODA to manage the program for the multi-states. It just so happens that that administrative program for the multi-states is run out of our state and this agency. Clear? That's why time just like when somebody likes to see.
Yeah, I need a diagram to help explain it.
Mhm.
Yeah.
Isn't it kind of purchasing power so that as an agent, as an entity, it can represent several states and have larger,
Yes,
am I missing something?
that is the design behind
Yeah.
this pooled purchasing of prescription drug lives. Yes.
Here.
I see Harry's hand, I think.
Yeah, thanks, Dave. Regarding this TPA spending authority and the actuarial services, those dollars, are they specifically for PEB or does SEB have a separate set that you would present to them that is different than this? Or
Yeah.
does it?
Yeah, Harry, SEB has its own separate request for these two line items. They are accounted for in completely separate accounts. So we do two separate requests, one for PEB and one for SEB.
Kind of related to your question, Harry, in the appendix of Tanya's presentation, the very last slide 15, you'll remember or see that there are slash marks for all of the accounts. The left side is PEB, the right side is SEB. This is just an embodiment of there are 10 primary accounts that are used. And so everything is tracked separately for these. And so you can see right here, thank you for moving to it, in that the third box, the first purple one, you see 439 and 494. That's the TPA count for the Uniform Medical Plan, Regions and MODA expenses. And 439 is how we track it for PEB, and 494 is how we track it for SEB. So there are separate numbers. When we do a decision package, we do it combined, and then we line item out the impacts for PEB and the impacts for SEB account by account. And so we are tracking everything separately across all 10 of these accounts, if you will, that are described here on this slide. Tom?
So is that, looking at that slide, so UDP admin, UMP admin, and agency admin, are those all separate then?
Yeah.
SEB and PEB?
Mm-hmm.
Correct.
There are no combined PEB and SEB funds. They're all separate.
The structure looks the same. They're kind of like mirror universes of each other. And that's why we describe them in the same format, but they are completely separate, tracked accounting purposed accounts.
Yeah.
Okay. We'll go back to slide 6.
All right. And then the third one on this list is related to the stabilization of our benefits 24/7 system. We received in the final conference budget a total of 9 FTEs. 5.5 of them will be charged to the PEB program. The 3.5 will be charged to the SEB program. There's a little bit more weighted towards the PEB program because of the support for our retirees that live in the PEB program, not the SEB program. This one's really exciting for us. I believe Jean is later in the agenda and going to talk a little bit more about the plan to onboard some of these FTEs that we received within the budget. Okay, on the next one, the first two are related to benefits. The first one is regarding doulas. We received funding in the Uniform Medical Plan to add coverage for doulas. Doulas are not currently a reimbursable provider type within our PEB and SEB Uniform Medical Plan offerings. So coverage of doulas would be subject to the ability to operationalize this. We are still working through this with our TPA regions to see if this is something that can be operationalized for 2026. If it is, we have the funds available to do so. If not, this is something we'll continue to explore for plan year 2027. The next one on the list is related to dental benefit enhancements. We received funding in the Uniform Dental Plan to, one, remove the deductible for children under the age of 15, and two, to increase the TMJ benefit. These are to get us closer in alignment with the SEB program. The SEB program, as part of their collective bargaining agreement a couple years ago, negotiated some additional investments, which resulted in increased dental benefits. And these two bring us closer in alignment on the SEB program with the SEB program. And then the last one is some administrative dollars related to Senate Bill 5083. This is our agency request legislation related to the hospital affordability bill that Cade described. We requested 1 FTE that'll be in the finance team that'll work on our team to help with some of the financial work related to this bill, as well as a little bit of actuarial dollars.
Before we move on from slide 7, I do just want to again highlight, back at the retreat, we had the budget director from OFM come and talk about the state of the budget. We've all read news articles, know about the conversations and bills passed in the legislature. And so I did want to just kind of connect a piece of how are their benefit enhancements in the context of budget deficits, the scale that have been talked about with our state budget. These, $400,000, $360,000, that is, in the context of a multi-billion-dollar budget, very small amounts. What we are fortunate about in the PEB and SEB programs is that the funding rate does not need to be adjusted for even the combination of these two benefits. So, the dollars that have to come and flow out of the state general fund through agencies and school districts via a funding rate to come over to fund these programs is a fixed dollar amount. And as there are changes in the program and increases in spending, it takes about $1.5 million, $1.7 million to adjust that funding rate by a single dollar. And so there are some times where there are small changes that can be just absorbed within the risk of the overall funding that exists, and the legislature and the governor will authorize some additional risk that exists essentially within the current funding. We do need, and the program and the board needs, the legislature and the budget bill to kind of grant the authority that says they acknowledge that that risk is baked into the current funding rate number, which again is not a magic number. And so our strategy and thought during this time, knowing that the budget deficit was going to be very large that was talked about, was to focus on very small changes that would not in their totality influence the funding rate. And that's why there was a little bit of success in this area, despite the bigger challenges that are happening with the state budget, because authorizing these didn't actually require any additional investment. So I just wanted to tie that together. We anticipate that in the short term, we're going to continue to be focusing on looking in the portfolio about minor adjustments like this as the potential for any changes that happen in benefits in the near future.
All right, on the next slide, we're going to talk about a few additional things that were included in the final conference budget not related to decision packages. The first one is the combining of the PEB and SEB programs. This is really only for budgeting and accounting purposes. This really ties back to Harry and Tom, your questions about kind of the accounting. When we talk about the accounts all being separate, in this scenario, they're still all completely separate. We're budgeted and tracking expenditures completely separate still for the PEB and SEB programs. But when we think about like kind of the hierarchy in the accounting world, currently there are two programs. There's a PEB program and a SEB program with all of the accounts under them. We are just consolidating the PEB and SEB programs into one program, but we will still have all of the distinct accounts underneath them separate. This is really to ease some of the errors that have happened historically and the duplication of work. This came as a request of the budget 2 years ago to analyze this, because at both the legislature level and OFM in the governor's office, when they are looking at, for example, the PEB and SEB benefits 24/7 IT resource request we had, they literally have to flip between two screens when they're deciding what they want to fund. When our request comes over, it comes over in two separate areas, one for the PEB program, one for the SEB program, and they have to mirror both of those up. Now it'll come over as one, but it'll still have the two separate accounts on it. So this is really just a behind the scenes technical accounting function. The other place you will see this is if any of you are familiar with looking at the budget bills. Historically, there has been a section 212 for PEB and a section 213 for SEB. Now there will be just one section for employee and retirees benefits, but all of the distinct separate PEB and SEB accounts and provisos will be still underneath that one section. The next one is the authority. There was language included in the budget for the board to have the authority to increase the employer paid long-term disability benefit from $240 to $450 within existing resources, meaning with the same premium we have been paying historically, we have the ability to increase that benefit limit and pay the same premium. So that'll be something Kimberly will be up later to talk to you more about. And while we're on the theme of long-term disability, let's flip to the next slide. The first budget or the first bullet goes along with that long-term disability conversation. Because our premium dollars have been able to go a little further and we could have enhanced that benefit, we have been building surplus. There's some additional surplus in our reserves for our employer paid benefit. That is completely separate from our employee paid benefit. We are going to withdraw those reserves to deposit into the state general fund to help with the budget deficit. For the PEB program, that's about $18 million. That's above and beyond what is required to keep in those reserves. And so we're going to withdraw those in July and deposit those into the general fund. The next one on the list we've talked about a bit, which is the closure of the UMP Plus plans at the end of the current plan year. As a reminder, the current contract expires at the end of 2026. So the legislature included language and dollars in our funding rate associated with closing the plan at the end of the current plan year. I believe the intent is later in the board season to have a little bit more conversation around what that looks like. The next one on the list relates to some of the conversations we've had around the budget reductions. The little flow chart that we brought up in the appendix a few minutes ago, we talked at the last meeting around some of those accounts and how the dollars flowed. We did receive in the final conference budget reduction of our agency admin of 6%. So it was that far bottom right bucket of dollars. It's really the bucket that pays for our staffing, the building costs, phone costs, travel, some things like that, not related directly to our benefits. So we did not receive any directions to cut any of our benefits outside of what we're talking about, and did not reduce any of our other accounts, with the exception of the few things we're talking about right here. The next one is a reduction of our premium stabilization reserves. We call this PSR. So within the PEB and SEB programs, we have various types of reserves that sit in different buckets. Our PSR is really related to stabilizing premiums in kind of a short-term emergency way. So we don't have to go back to the legislature for emergency funding. Things like COVID, where we have some increased costs for vaccines and things. This is to help stabilize those premiums in those short-term periods. Currently, we keep 7% of our annual self-insured medical claims in reserves, and this would reduce it to 5%. And what this does essentially is freeze up those dollars, so the difference between 7% and 5%, as a one-time reduction to the funding rate in fiscal year 26. On the next slide, we have some further budget reduction bullets related to the closure and elimination of the Smart Health Portal incentive. Kate described Senate Bill 5807, which eliminates the Smart Health Program effective January 2028, meaning the last distribution of incentives will be in January of 2028. And as we get closer, that's a few years away, we will have some additional conversations with the board on that process. As a reminder, I think in the last meeting, I brought to you two different approaches to this. One of the versions of the budget had language saying eliminate it, while one version had a separate bill. And the final conference budget includes the bill that passed 5807. They essentially did the same thing at the end of the day, just took two different approaches. On the next slide, these are the final funding rates for the next biennium. So 1333 in fiscal year 26 and 1350 in fiscal year 27. These funding rates include the funding for all of the decision packages we talked about. It fully funds the collective bargaining agreement that was negotiated last summer. It funds our agency request legislation, as well as includes the decreased dollars associated with the budget reduction proposals. And John, this really kind of just shows that that funding rate is really the funding we get. We get this one line item. So if something were to be individually line item vetoed, it's going to be really hard to come back and rebalance this one number.
I'm just want clarification. So this 1333 for 2026, is that what we also have for 2025?
No, the 2025 number is $1,170.
Okay.
Yeah, it does change every single year. And what you will, I'm willing to almost bet my salary on it. Next year, you'll see this second number for fiscal year 27 change. So when I'm back here next year, same time, you'll more than likely see that second number change. And that's just really due to the nature of the timing of when we, create these projections. So when we delivered modeling to the legislature for them to make their final budget, we're projecting things, 18, 24 months into advance. We're also doing it in advance of rate setting and open enrollment switching. So as we get additional claims utilization, updated rates, employees switching, our model will change every single quarter. And so by the time the legislature convenes next year, we'll have closer projections to give them. And then the last item for discussion is just really around the Medicare explicit subsidy, which remained the same from the current plan year at $183 or 50% of the premium, whichever is lesser. Tom.
I have another question.
Yeah.
I can't remember where I read this or saw this, but at some point, was there a consideration, the explicit subsidy had been 183 for 5 years, I believe, at that rate. And then before that, it was like 151, maybe?
168, I believe.
158. Was there ever a consideration to reduce the subsidy as part of the way to save money?
I think the best way to answer this question is if we go back to the March board meeting, there were, every time there is a budget deficit or challenging budget scenarios, agencies are asked to put forward different components. The PEB and SEB programs are a little unique in that they are not considered general fund state, and those exercises are usually about general fund state expenditures. But at the same time, there is always a kind of a similar request made for the PEB and SEB programs to describe potential levers that the legislature could pull. And there are a couple of historic levers that are always described. And on that description, there was a piece about the Medicare explicit subsidy, just like there was a piece about the potential closure of the wellness program that's been on a list every time that this exercise has happened, at least during my tenure, so at least 3 times. The Medicare explicit subsidy is always a lever that could be pulled. And so historically, this agency just describes the extent of that subsidy and usually just shows math for a couple of different scenarios. We modeled an elimination and a reduction of 50%, but really the legislature and OFM know this lever very well. They know how to model it. They know how to plug in the number and figure out exactly what it would be. I'm not aware that there were any significant conversations about adjusting the Medicare subsidy during this past legislative session. Though there are people who saw the agency's budget reduction exercise and believe that maybe the agency was promoting a cut. We were not, none of the things that were in PEB and SEB were promoted cuts. They're all very different scenarios. They're also not really even mutually exclusive ideas. Like I said, you couldn't both reduce or eliminate the subsidy. It would be one or the other, just like there was modeling of various percentages of employer-employee splits under the PEB program. That is part of the collective bargaining process. So we always describe the levers, but I'm not aware of any significant conversations, and the agency doesn't take a position per se on the Medicare explicit subsidy. We just help people understand it and model different numbers for them. But that is one area that we are historically not super consulted on what the final number will be.
And just clarifying, when the agency put together its budget cuts, it was putting together cuts of what is technically possible. What could we do? So there was no value judgment on any of them. It's just like, yep, we have, that could change, this could change. So, yeah. Yep. All right.
Any other questions?
Other questions for Tanya? All right, Tanya, thanks so much. Stella, how are you doing today? Come on down.
This is right.
Yeah.
Come on down. Come
Yeah.
on down.
How much you think this gavel's worth? All right. Stella Ing, Policy Rules Coordinator in the Herb Division, is going to bring back a resolution for us to vote on today. After she reviews the resolution, we're going to ask for the motion, the second. That's when we're going to invite public comment on the resolution. Then we're going to talk about it as a board and get prepared to vote. Her materials behind tab number 6. Welcome.
Thank you. Good morning, Chair McDermott, members of the board. My name is Stella Ng, Policy and Rules Coordinator for the Herb Division. This slide and next slide are included in the presentation, so you have them available for the policy we will discuss.
Tab number 6, if I failed to mention that.
Thank you. Next slide, please. We have one policy resolution for action. Resolution PEB 2025-02 addresses PEB retiree insurance coverage when the subscriber's dependent becomes eligible for PEB or SEB benefits. Next slide, please. And we received no stakeholder feedback for this resolution. Are there any questions from the board?
All right. We're going to vote on resolution PEB 2025-02, PEB retiree insurance coverage when the subscriber's dependent becomes eligible. Resolved that when the subscriber's dependent becomes eligible for the employer contribution toward PEB or SEB benefits, the subscriber's dependent will be auto disenrolled from PEB retiree insurance coverage. Is there a motion to adopt?
So move.
Is there a second?
Second.
Do we have any comments from the public? If you want to make a comment and you're in the public, please raise your Zoom hand. Anyone in the room? All right. Any comments from the board? This is going to be a roll call vote starting with Sharon.
I approve. I agree.
Elliot?
Aye.
Tom?
Yes.
Michaela?
Yes.
Kurt?
Yes.
Harry?
Yes.
And Lou, yes. Resolution 2025-02 passes.
Next slide, please. So the next steps we have will be, we will issue guidance to employing agencies. We will prepare communications for our members, and we will incorporate the resolution into the PEB program rules. Thank you very much for your time.
Any other questions for Stella? Stella, thank you so much. Appreciate it.
Thank you.
All right. Why don't we take a 10-minute break? We'll come back at 10:35.
Okay. We hit it right on almost.
All right, folks, we're getting back in action here. All right. Kimberly, Is Kimberly with us? Oh, there you go. Next, we're going to hear about LTD. Kimberly is our senior account manager in ERB, is going to provide us an update on some changes to PEB's program, long-term disability benefit, and introduce a resolution for board action, I assume the next meeting. Yes. Materials behind tab number 7. Kimberly, welcome.
Great. Thank you. Thank you, Chair and board members. Next slide. There we go. So the PEB program has the opportunity to increase the employer-paid LTD benefit, which has not been increased or changed since 2003. And 48% of PEB subscribers are only enrolled in the employer-paid LTD plan, which means they currently only have a maximum monthly benefit of $240 a month. So when they experience a disability that prevents them from working, they're only getting $240. Next slide. The PEB program will be able to increase the employer-paid LTD benefit amount to $450 without increasing the employer-paid LTD rate and still maintaining the required 1 year's worth of premiums and the reserves. The operating budget, the 2027 operating budget includes the authority for increasing the PEB employer LTD benefit from the current $240 to $450. And as a result of increasing the employer-paid LTD benefit, the employee-paid LTD rates will also decrease by about 6%, and that would be effective January 1st, 2026. Next slide. So this slide here is the PEB resolution from 2021, which outlines the current employer-paid LTD benefit details. The red line version of this slide with the proposed resolution changes is for PEB is on slide 6. So we'll go over that shortly. Next slide. This slide just shows the specific changes that will be amended for PEB resolution 2021 line by line. Next slide. And then this slide here shows the red line changes, which you'll see we are increasing the maximum monthly benefit from $240 to $450. And the effective date change will be January 1st, 2026 for the $450 increase. Next slide. Excuse me. This slide reflects the 6% decrease in employee-paid LTD rates, which, if approved by the board next month in June, would be effective January 1st, 2026. Next slide. Great. So we provided 2 monthly employee paid premium examples here. So the first example is with the 60% coverage, and the second example is with the 50% coverage. So moving back to the 60%, Lisa is a professor at the University of Washington, making $5,000 in monthly earnings and has elected additional coverage at the 60% level. In 2025, the current monthly premium is $26.50. In 2026, with the decrease, the monthly premium would go down to $25. Second example, Glenn is an employee at the Department of Social and Health Services, making $4,000 in monthly earnings and elected additional coverage at the 50% level. The current 2025 monthly premium is $10. And in 2026, with the decrease, the monthly premium would be $9.60. Next slide. Yeah, go ahead.
I have a question. In higher education, I understand that the LTD benefit includes contribution to your retirement plan, both the employer and employee. Is that true of all state employees?
Higher ed has a separate grandfather provision.
Okay.
So no.
So no, so
Yeah. So that's just,
this is a separate, yeah.
that's just,
State.
okay.
Yeah.
Great, thank you.
Yeah, no problem.
I have a question.
Sure.
On page 6, there are 2 terms that I don't understand, and they're the next to the last, the 2 ones that are the next to the last lines.
Mhm.
No choice sick leave, what does that mean?
So-
And then what does choice pension
Sure.
mean?
Sure.
Thank
So,
you.
Yeah, the no choice sick leave just means that for an employee to receive the benefit, they would be required to use their leave before any LTD benefits would be paid.
Okay.
And then for a choice pension just means the employee does have the choice to use or not use their pension before any LTD benefits are paid.
Thank you.
Harry, you have a question?
Yeah, thank you. I do. Hope I can phrase it correctly. It's really two questions, I think. One, let me ask the two questions and I get the answers. Is the employee rate tied to the employer rate? By that, I mean, if for whatever reason the board chose not to vote in favor of raising the employer paid from 240 to 450, would the employee paid still be able to be reduced? That's question one. And question two is, I don't have any objection to this. I don't want anybody to think uh, I'm opposed to this, but there's obviously, if the rate were left at 240 on the employer paid, could those savings, if I could call it that, be then applied somewhere else within the benefit package? I believe the board has the ability, if it wanted to shift dollars. Those are my questions. Thanks.
Sure, I'll take the first one, David. You said. So if the employer LTD benefit is not increased, there would be no changes to the employee paid LTD rates. And how that works is because as the employer covers more of the insured earnings, that's what causes the decrease for employee paid LTD rates and why those would go down for employees.
I want to make sure that any follow-up questions on question one, Harry?
No, I think that's a great answer. Thank you.
You're welcome.
The other way I think of it is the two benefits dovetail together. So as one's ceiling raises, that obviously adjust the amount that I'm going to stop. It was clear. The second question about what the board's kind of authority is in the area. So when Tanya was up, she was describing the benefit authority, that language that's in the budget. The budget does give language to essentially say within existing funds, the benefit level can be increased. For clarity, the other answer to this question could have been no, keep the benefit at the same level and tell us the incremental cost. I'll just call it a dime or a quarter, reduce your rate that you're paying and give that back so we can reduce, the legislature can reduce the funding rate perhaps, and then lower the overall cost of these programs. Instead, the decision in the budget was, nope, we will continue to give the authority for spending the same roughly $2 per month that has been paid for the last couple of decades, and you can increase the benefit. So Harry, your question then is, well, could we do something else with that dime or quarter instead, or the totality of that cost? I'm going to have to come back to you next month on that exact question, because over the years, there has been language that has sometimes been in section 212 and sometimes has been in section 213 for the PEB and SEB boards that relates to authority and when there are reserves or savings, what has to happen to them. And I just can't quite remember what the final version of the collapsed section in the budget has on that point. I believe that there are parameters that do answer this question, but I just can't answer for you today.
And the reason I bring it up is because I know we're going to go into an executive session. I don't know, obviously, what we'll discuss in there. And so I'd like to have the full financial picture before we clearly vote on a resolution to apply. If there are funds that could be saved, shifted, adjusted, whatever, I'd like to have the entire piece. If we're talking 10 cents, obviously it's probably not a big deal. But that's kind of where my question's coming from. Thank you.
And I will say, Harry, to your point, it is, my illustrative example was a dime or a quarter. It's in that magnitude because it's only where the state is only spending $2.10 per month on the LTD benefit. So it's a very small amount. And that if you try to theoretically apply that dime or quarter to medical, it would become less than a penny in the grand scheme of the cost of medical. It's just the dynamic of the LTD benefit and how far a dime goes is very different than how far that dime doesn't go when it comes to medical or dental insurance. So it's very unlikely that the value that we're talking about, that's the incremental change related to this benefit enhancement and long-term disability, the employer paid long-term disability benefit, would be able to influence in any way the totality of the expenses on medical or dental. And John, you have a question?
Yeah, this is a little bit off target, but prior to paid family and medical leave, we offered a short-term disability plan. Did we have the same kind of surplus in that plan that we have in the long term? But do you remember?
The state hasn't actually run a short-term disability plan. We looked into it and we explored it, and we did a procurement when we did the procurement for the PEBB program back in summer of 2018. We evaluated whether to do a short-term disability benefit alongside with long-term disability, but that was ultimately shelved
Okay.
because of
So we
what
never had one prior
Yeah.
to paid family and medical leave that
Correct.
was a new benefit for state.
What we used to have was we had, I think, 6 or 8 different waiting periods, and the smallest waiting period was 30 days. And so some people thought of that as a potential way, but it was really a long-term disability benefit with a short waiting period. There's never been a short-term disability benefit run by HCA for PEB or SEB.
Before I joined the board.
Elliot, do you have a question? Your mic's still on. Okay.
No, I'm just reacting.
And go back to slide 9. All right. So next steps for increasing the employer paid LTD benefit would be submitting LTD policy resolution feedback by May 23rd. We would then bring the recommended proposed LTD policy resolution to the board for action next month in June. And then the PEB employer paid LTD benefit at the 450 amount would become effective January 1st, 2026 if voted on the board. Any other questions?
Any additional questions for Kim?
I do have one piece just to make sure is really clear, is that when we say the change is effective January 1, 2026, that also means for the people who are currently on a disability claim, they don't get the benefit of this increase. The change is for new claims that are filed as of January 1st. So if somebody went out on a claim this December, their claim is incurred, the claim incurred date is in December of 2025, and they would have a benefit level of $240 even once the ball dropped and became 2026. It's only brand new claims that are begun on or after January 1, 2026 that have the benefit of this increased benefit level. So just wanted to be very clear about that. And that is also how the state's paid family medical leave benefit works as well. So it's very similar in that model.
Appreciate that, Dave.
And I just wanted to make one correction. I was just notified the feedback deadline is actually May 26th. Sorry about that. Couple more days.
Instead of,
The 23rd, 26th
Got
instead
it.
of the 23rd.
okay.
Thank
Noted.
you, everyone. Appreciate your time.
Thank you. Ryan, you're up. Ryan Ramsdell, UMP team manager in the ERB division, is going to introduce a resolution today regarding a change to breast exam coverage. We're also going to be voting on the resolution today, which is not our normal cycle, and Dave's going to talk a little bit about why that is.
Yes, trying not to get too much into Ryan's thunder. Some things happened since the board acted on this very topic last board season that allow the potential for a change this plan year, again, retroactive to January 1, 2025. And so that in itself is unusual. And because of that and the likelihood of the board agreeing to this policy statement, we have asked regents to hold claims on these types of services right now so that they don't adjudicate them under one policy and then have to re-adjudicate them under a separate policy. And so we're hoping that the board can take swift action so that we can then have regents adjudicate the claims once rather than twice, reduce the administrative paperwork that everybody receives, and just have this all in place rather than having those claims held for an additional month. So that's really why we're asking. But with that, I will ask Ryan to go on to the actual topic in more detail.
Chair McDermott, members of the board, my name is Ryan Ramsdell. I am the UMP TPA account team manager. We're going to be going over the CDHP benefit design here. Next slide, please.
And materials are behind tab number 8.
So as a reminder, in 2023, Bill 5396 came out, and that influenced how fully insured providers change their coverage for diagnostic and supplemental breast exams to a sort of a first dollar coverage treated similarly to preventative services. It did not hit their deductibles. However, or I should say, in addition to that, in late 2024, the board did vote to align the UMP or the self-insured coverage to be similar to the fully insured coverage. But because of the intricacies of the IRS and high deductible plans, we had a caveat in our resolution that called out the fact that for high deductible plans, they would have to meet their medical deductible first before this benefit went into play for them. In late 2024 into 25, the IRS issued some guidance regarding their assessment of that. I know it gets confusing, but with high deductible plans, sometimes I think Dave refers to it as the first dollar rule. If the IRS doesn't call it out explicitly, then in most cases, it's going to have to hit the medical deductible for high deductible plan member in order to avoid posing problems for the health savings account component of it. That's a large part of it anyway. So in 2024, the board voted. In 2025, the OIC as well as the IRS provided additional guidance, which we are now in possession of and are asking the board to make a adjustment to that resolution or update to that resolution going effective January 1st, 2025. This is truly an enrichment to the members on the high deductible plan. So what this adjustment will do is strictly to eliminate mostly a single line that gets rid of the reference to the medical deductible needing to be exhausted first before high deductible members get this benefit. Next slide, please. So let's go to the additional slide after that. I kind of covered it. So as adopted back in May of 2024, the resolution 2024-23 originally stated beginning January 1st, 2025, diagnostic and supplemental breast exams to be covered at no cost share to Uniform Medical Plan UMP members. UMP CDHP members need to meet their deductible before the plan will pay any portion of the claim. Next slide. The proposed edit here is beginning January 1st, 2025, diagnostic and supplemental breast exams are to be covered at no cost share to Uniform Medical Plan UMP members, period. And next slide. So this is how the resolution reads. And that is, any questions, I suppose?
All right. So as we all know, going to ask for a motion to adopt a second. We're going to do public comment on the resolution. We're going to do the board discussion, and then we're going to vote. Elliot?
So moved.
Okay, hold on. We're jumping on it. Here we go. We're going to now vote on Resolution PEB 2025-04, amending Resolution PEB 2024-23, UMP diagnostic and supplemental breast exam coverage. Resolved that beginning January 1st, 2025, diagnostic and supplemental breast exams will be covered without member cost share to Uniform Medical Plan members. Do I have a motion?
So moved.
Is there a second? Second. Any comments from the public? Any hands on Zoom land? Anyone from the room? Seeing none, any additional comments from the board? Seeing none, roll call vote, starting with Sharon.
Yes, I agree.
Elliot,
Yes.
Tom,
Yes.
Michaela,
Yes.
Kurt,
Yes.
Harry,
Yes.
and Lou, yes. Resolution 25-04 passes. Ryan, thank you very much.
All right, I just want to thank the board for exercising that discretion and going outside of our normal procedures of waiting a month. Again, it just allows, this is kind of the efficient way of doing this and having claims adjudicated. So we don't like to bring things in this manner, but I do appreciate your entertaining that change so that we could get those claims adjudicated and make that adjustment.
The board was eager to vote.
Yes, and move.
All right. Next up, Jean Bowie, Deputy Director of PERB Division, is bringing back the latest happenings with the agency's work on benefits 24/7. Is Brett joining us?
No, I am
You got it. You're
pinning
flying
for-
solo.
I am.
Jean's materials are behind tab number 9. Jean, welcome.
Great, thank you. Good morning, members of the board. Chair McDermott, as Lou mentioned, Jean Bowie, our Deputy Director. And we've been sharing with you through the last few meetings our efforts to stabilize our enrollment system benefits 24/7. And so I've got the latest installment. So next slide, please. So over the last couple of months since we've begun the really intense stabilization efforts, we have pretty dramatically addressed the tickets and the backlog and some of the general errors that that we had been seeing with the system. And so Brett has highlighted some of the the work that has gone on with those tickets and the and some of the bugs that have been addressed. Next slide. So as Tanya mentioned in her presentation, we were very fortunate to receive funding for several IT positions. And so we've listed the intended types of positions that we will be, there are in various states of hiring for the project. And so the one that's a little bit further along is the lead position, and we had that one is. It hasn't been posted yet, but it is in well into the recruitment phase. We have a tester that has already been hired. We had some. We're holding some positions and had some vacancy funding that we were using to get a jump on this because of the needs that we had with the stabilization and getting the system going. So, and then we have the 2 business analysts and 2 developers that are the folks are working on position descriptions and hoping to get those rolling here pretty soon.
I'll just clarify that when we say holding for budget confirmation, we won't actually act until the budget is signed, which is no later than next Tuesday. But again, the funding for these positions is wrapped up into that funding rate number. There's no words in the actual budget bill that specify, X number of positions are coming here. There's not a specific allocation. So these positions, they're literally, you wouldn't see them in the budget bill other than as embodied within a component of the funding rate. So we feel that they will be coming. So we've begun kind of the internal processes for these. The other positions, because Tanya highlighted that this decision package was 9 positions. There are 6 that are for IT. There are 2 that are in our finance accounting department, so individual account adjustments and working on billing issues. And then 1 in our outreach and training department, which is the entity that benefits administrators from agencies and school districts and higher education institutions consult with on administering the benefits program. So that's where the 9 positions are. And we similarly will be working on the other 3 positions that are outside of IT for recruitment.
Okay, next slide, please. So in addition to the stats that I shared earlier about the tickets and the work, we're also receiving some pretty positive feedback from our various stakeholder groups. And so we meet regularly with PEB and SEB benefits administrators, and these are the folks who in the agencies and in the school districts are on the ground working with employees and, very intimately involved with the issues that have been going on with benefits 24/7. And we've like I said, we've received very positive feedback about tickets being resolved much quicker, and the level of issues in general just going down. Additionally, during the feedback meetings, we have gotten a lot of willingness to work with us in, for focus groups and that sort of a thing. And so we've recently convened a work group of business administrators to get their insights around the reports that are generated from benefits 24/7. And so the team, this work group has given us kind of a priority on the reports that are most needed for their work. And so the Benefits 24/7 team has been working on these reports and expects to have those available later this summer. And, again, making sure that these are the reports that our folks need in the field. We continue to send out weekly messages to the benefits administrators on the status and some of the issues that have been identified. And that has been another area that we've received very positive feedback as to the, just the transparency of the work that is going on with the stabilization. Next slide, please. So I think I had shared previously that the Benefits 24/7 team has just been, really singularly focused on the work. And so as, in order for us to support that work, we as a program had agreed to really limit any of the extra work that was being required of the system and the team. And so, with the legislative directives and mandates, those would have to be done, and that would be similar to the closure of the UMP Plus plans this year. So that is work that the team is doing, but there are certain improvements to the system that we would like to see that we're going to be holding off until next year to even start looking at that. And just to illustrate, we had two really large projects this last year with launching the standalone vision for PEB and the Part D for UMP. And those really were very resource intense for our systems folks. And so that, with that experience from last year, we agreed that working on stabilization and kind of holding back on those large efforts this year is going to be a benefit to all of us.
And I'll add, fortunately, from the legislative process, there are very few things that actually impact our IT systems that are embodied within the budget. The changes that exist related to the flexible spending account program and under the collective bargaining agreement don't really impact our IT systems. A potential increase to the LTD employer paid benefit requires kind of some language change on benefits 24/7, but not new programming. The winding down and closing of UMP Plus, from an IT perspective, it's much easier to close a road than it is to build a new road. So, those types of things, those are really, and the closure of Smart Health, which is delayed by several years, doesn't have any immediate IT impacts. So those mandates that come from the state perspective or from the legislative process are fairly minimal when it comes to IT. So we really are able to not distract from stabilization work and just continue debugging and, and making things sync across the system. So.
Any additional questions for Jean? I know from behind the scenes, keeping an eye on this, I've seen dramatic improvement in the backlog and some of the things that need to be done. There's all hands on deck effort going on right now. So nice job.
Right. Thank you.
All right, thank you. We're going to transition to public comment. If there's anyone, the way we're going to do it is, again, people are going to say, I would like to make some comments. We're going to go ahead and spotlight them. They take themselves off mute. They'll have an opportunity to comment. We're going to limit it to 3 minutes a person. We sometimes run into issues with the number of people who want to comment, sometimes none at all. So if you would like to make a comment first, looking at the room, is there anyone? Actually, I saw your hand go up. I was like, you'd like to make a public comment? And she's like, putting on a sweater. Seeing none in the room, how about out in Zoom land? Do we see individuals who would like to make comments? We're getting the list together. Yeah. Thank you. All right. First on the list is Dr. Berry. Dr. Berry dropped. Maybe we'll see if Dr. Berry comes back. And we have Aruna. Have you
Hello.
found? Hello.
Yes. Yeah. Good morning.
Good
My
morning.
name is Arun. My name is Aruna Bhuta. I'm from Spokane, and I'm a IPEC member. And I wanted to thank the PEB board for the quick action on the breast exam coverage and the LTD issues. My question is around 24/7. As a consumer, how is 24/7 going to impact me? And where can I get more information? You know, the stabilization and all, and good feedback is encouraging, but just wanted to know. Maybe it's too simple a question, but thank you.
Dave, do we want to address that?
Aruna, this is Dave. We have been, so Benefits 24/7 launched in January of 2024. And so it is a mechanism by which retirees, I'll just focus on retirees as I know you're representing retiree organizations and are a retiree yourself. It's an option for those online as an online enrollment mechanism. We have not banished paper or abandoned paper as an option, so retirees have either option. When we rolled out Benefits 24/7, we did have some initial communications around the use of Benefits 24/7, and each open enrollment, we will continue to provide information about Benefits 24/7 and where one can go for IT support if you're having challenges with Secure Access Washington and getting into the system, and so there is going to be information each year as part of general open enrollment materials about this option as part of retiree communications. So we'll continue to share information that way. And then if you have additional questions, if you just drop Jean or I an email, then we'll connect you with some more people to answer more specific questions.
Thank you, Dave. We have Dr. Berry. I think we're giving you the ability to get off mute and go ahead and make your comments. How are we? Dr. Berry, if you appear to be muted, if you could unmute yourself. Oh, there you go.
Can you hear me now? Okay, sorry, I'm just switching between multiple screens and it keeps changing. Now I can't find where my video is.
Video is not necessary if you want to just go ahead, but
okay, that's fine. Okay, yes. So good afternoon, members of the board. My name is Dr. Alicia Berry, and I was born and raised in Washington State, and I'm going to be returning home this July for fellowship at the University of Washington. And I'm speaking today not only as an incoming public employee, but as a union member, labor organizer, and someone who has spent the last 4 years in New Mexico fighting for improved access to healthcare at both the state and federal levels. I am here to urge the board to re-examine your current policy, which denies health coverage to domestic partners unless they are legally married or over 62. When I reviewed my benefit options for my new job, I was shocked to discover that Washington, a state that I see as having a proud legacy of LGBTQ protections and trans-inclusive healthcare, refuses to recognize my partner of over 7 years as eligible for coverage simply because we're not legally married. It's especially disheartening that the same domestic partner statute originally written to protect same-sex couples before marriage equality is now being used to exclude families like mine from the very protections it was meant to offer. I thought we already fought this battle, but here we are again. We are a family. We own a home together. We share a mortgage, finances, car insurance. We moved across the country together for my job twice. And yes, we shout through the house at each other and yell back, "I can't hear you from the other room," just like every married couple. But because we don't have a government issued piece of paper, my partner will not have health insurance coverage when we move there. Washington is about to become the only place I've worked where this has been an issue. In both Oregon and New Mexico, my partner was eligible under my plan through a simple notarized affidavit confirming our shared financial and domestic life. My partner is a contract archivist in a field that offers no employer-sponsored benefits. I carry nearly $500,000 in student loan debt because I came from a working class family and we're moving to one of the most expensive cities in the country. We cannot afford a second insurance policy out of pocket, and we shouldn't have to. I should not be forced into a legal contract to secure basic healthcare for my family. It's a sad and frankly absurd reality when a physician cannot get healthcare coverage for their own household. And this isn't just about me. This policy disproportionately harms women, LGBTQ families, lower income workers, immigrants, and anyone who has a valid, complex reason for not pursuing a legal marriage. And let's be honest, in 2025, family does not look like it did in 1950. According to Pew, more adults in the US have cohabitated than have ever been married for the first time in history. And right now, more people are cohabitating than there have ever been. Our systems need to evolve to meet reality. If Washington is serious about equity, then it must start with how you define and value families. Excluding people like my partner from healthcare coverage is not just outdated, it is unjust, and it contradicts the very values that the state claims to uphold. And the legal marriage requirement also raises real concerns about marriage status discrimination, which Washington law explicitly prohibits in housing, employment, and insurance. Yet here I am, excluded solely because I'm not married. For many, especially queer people, this decision is shaped by past trauma, family history, legal complications, financial consequences, or deeply held ethical beliefs. Nobody should be forced into a government-sanctioned relationship to access healthcare. That is not inclusion, that is coercion. Washington courts already recognize long-term marriage-like relationships for the purposes of property division and probate, what's called a committed intimate relationship. But there's no equivalent recognition while people are still alive and together and need healthcare. That legal gap is causing real harm. It is a moral and legal contradiction that needs to be addressed. I'm not asking for special treatment. I'm just asking for recognition of the family I've built and reasonable policies that reflect the lived experience of public workers. I urge the board to re-examine the eligibility rules through a genuine equity lens, consider how the current policy unintentionally harms the very people that Washington sought to protect when it originally created domestic partnerships, and consider adopting an affidavit-based process for domestic partnerships, as many other states and institutions already do, in alignment with your stated commitment to ensuring that Washington residents have access to high-quality, affordable healthcare. This is a matter of health equity and basic human rights. Please broaden the definition of dependent eligibility so that all public workers can care for their families. Thank you.
Appreciate your thoughtful comments. Others? All right.
Is that something that this board can do, or does that require legislative approval?
There is I'll say, like, there's a multi-year complex history on this particular topic, and I think it might be good in light of the public comments that were received. And this question has come up a couple of times in the SEB context as well. So it's not a simple answer, but I think we can bring back and describe some of the history and where there is authority and where there isn't authority. I can remind the board that there was a time in which the domestic partner registry created by the state prior to same-sex marriage being authorized in statute was an eligibility provision for the PEB program. And then after the marriage bill passed, there was a shift in the legal analysis and risk and authority that resulted in our current policy. So there was a time when domestic partners, regardless of age, who were registered in the state registry could. Currently, the domestic partner registry, as part of that marriage bill, was limited to only instances where at least one of the individuals is over 62. So the nature of who could register under the state registry also changed at the same time. And some of those complexities are what led to the current policy that exists. So can absolutely bring back, like I said, it's a bit longer of a history. I just happen to know a bit more about it off the top of my head. But I know that I'm not going to remember all of the details, and it does have a lot of twists and turns to talk through. But it's certainly something we can bring back. And I see Tom has a follow.
Well, I'm just curious. So if I'm understanding you correctly, so the problem that she was describing at one time was not a problem, and now it is a problem.
Correct.
Because of changes within how that listing is made.
Correct. Their laws have changed on the recognition of various families in the last decade, and at different points, depending on what exactly was in place, there have been different policies for the PEB and SEB program.
And I'd like to make sure we're not trying to dig into this too much before we have a presentation put together and we're clearly articulating our points. Whoa. And yeah, I thought that was going to go. So we're not kind of winging it.
But the policy has changed over time
Yes, it
as
has.
laws have changed over time.
Yep.
I'm just asking for clarification. This is Elliot. So as I understand it, it's not up to PEB. The PEB board does not have the authority to grant what the speaker requested. Is it not the legislature that has the sole authority to clarify this issue or change it in some way? It's merely a question.
I will make sure that when we bring back this topic, we'll talk about which authority lies where. Sometimes there's overlapping authorities, but we will go through exactly on this issue what authority, who can make decisions where.
All right. Our next meeting is scheduled for June 12th, 2025 at 9 a.m. Same format, in person or via Zoom. And we're going to be going into exec session. But Dave, do you want to give us some planned topics for the June 12th meeting?
Absolutely, because when we come back from executive session, it will be simply to adjourn. Just I like to do a preview of things that we anticipate next meeting. We will bring you back the resolution and additional information for the hopeful action on the long-term disability resolution that was introduced today. We'll have a presentation beginning to talk about the closure process for UMP Plus at the end of the year. Every year we have an update on Smart Health. We won't really be talking too much about the closure in the farther in the future, but we'll be talking about the current state of that program. We'll again likely have a benefits 24/7 update. And we also, as we hit the beginning of June, we will start to talk about potential benefit design changes in the Medicare portfolio. We often, longtime board members remember, we often talk about Medicare first and then non-Medicare second. So we'll begin more of the public conversation about the benefit structure or any potential levers that could be pulled in the benefit design on Medicare. We won't really be talking about rates publicly until later in June, but we start to talk about the benefit levels and anything that could be happening there. And so we'll have that presentation as well. So that's some of the things that you can look forward to when we meet for the first time in June. A reminder that we will have 2 June board meetings.
Cool. And is there enough room on the agenda for the first meeting to discuss the issue we just went over? Or
I will talk with folks about where in the remaining board season to bring back that topic. I don't know if it'll be the beginning of June or if we can have that conversation at some point in this board season. I just don't know if it will be prepared for June 12th or not.
Understood.
So
just trying to meet expectations. Yeah.
Yep. For calendar purposes, do we think we're going to meet on the 24th and 31st of July?
I can't answer the July question quite yet. We have to see, we're in the early stages of the rate development process, about a week and a half into that. As we get a little closer into kind of the middle of June, I'll be able to answer where
You
we
recall
think.
last year when our last meeting was?
It was actually in August because we had an additional meeting when there was a special thing done by the federal government.
Yeah.
We will typically only have 2 of the meetings in July, and they will not typically be back to back. But I'm not quite sure exactly where we're going to land on which of those July meetings. And just it's easier to cancel meetings than it is to schedule meetings under the OPMA, so Open Public Meetings Act. So that's why we do it this way.
At this time, members of the public, at HCA, as well as employees not part of the executive session are going to be asked to wait out in the main lobby for the duration of the executive session. To be called back to join us to see Crystal for the remainder of the public meeting, which is just close the meeting. Coming up, and then come back into that. Be my guest. Pursuant to RCW 42.30.110 subsection 1L, the board will now.
Lou, your mic's not on.
It sure is.
Oh, I can barely hear you. I don't know if it's just me.
No, it's
No,
for
same
me.
here. Yeah, same here.
I was thinking, is my voice coming in fine?
Yes.
Yes.
How's this?
Better.
Okay, we might be having a mic issue. All right, pursuant to RCW 42.30.110 subsection 1L, the board will now meet in executive session to consider proprietary or confidential non-published information related to the development, acquisition, or implementation of state purchase healthcare services as provided in RCW 4105.026. The executive session will conclude no later than 1:30. Board members, let's take a quick break while we transition into our executive session. If you're virtual, please use the separate link given to you via email for the executive session, and we will see you there. The link was sent to you on Tuesday at 2:05 if you're looking for it in your email. And we're going to return to our public meeting to formally adjourn after executive session. And here we go. All right, everybody, we are back. Executive session has ended and this meeting is adjourned.